Good afternoon. My name is Dr. Clements. I'm going to be talking to you about a game changer known as Lenacapavir. Lenacapavir is our recently introduced ARV, and it's not just an ARV, antiretroviral drug, but it's a special one for prophylactic therapy, for preventative therapy. You know, this preventative therapy is actually has to take the place of the tenofovir based preventative therapy. And when you are doing that, it is important to understand that you will be taking tenofovir away from the patient, and tenofovir has got a very prominent role that it plays. If the patient has got hepatitis B infection, that hepatitis B is being controlled by tenofovir. Tenofovir will make sure that it suppresses that hepatitis B. It will, if there's an infection of hepatitis B. If there is no infection of hepatitis B, good. You don't have to worry. But if there is, you've got to let your doctor know that I've got hepatitis B and I was never vaccinated. You've got to make sure that the patient gets vaccinated when patient is being changed from tenofovir-based preventative therapy, that is PrEP, to Lenacapavir. Lenacapavir is taking over because, number one, Lenacapavir is only taken twice a year. That's very good, man. So it's long acting. So it will be there for the whole 6 months, and then you have to go and get another jab. You get injections. You get 2 injections, and you get the same time. You get your 2 injections, and then you get your 2 tabs, Lenacapavir tabs, and then the following day you go and get your 2 Lenacapavir tabs again, and that's it. So, and then you have to see your doctor after 6 months. After 6 months, that's good. So basically, this is a preventative therapy. We are using it as a preventative, not as treatment, not as an antiretroviral drug, as an ART. As we know, we're using it literally as a preventative therapy. And the first thing that you need to establish is that the patient has got to be negative for HIV. We don't use this for people who are HIV infected. So it's given only to people who are HIV uninfected. And that must be established by the healthcare worker, by the lab, to make sure that there is no HIV before you're given tenofovir. Before you're given Lenacapavir. Lenacapavir is so good. One has to think about its multimodal mechanism. That's what makes it better than all the other antiretroviral drugs. It's multimodal. It acts here, it acts there, it acts here. So basically, that's what you're going to do. And you rely on the attachment of HIV attached to the CD4 T lymphocyte. And for HIV to locate this CD4 T lymphocyte, it uses a GP120. GP120 is a glycoprotein that is actually on this envelope protein. Remember, HIV is an envelope protein. So sticking out on the envelope protein, there are glycoproteins. Glycoproteins, this is GP120. GP120 is attached to the surface of the host cell. Well, it is attached. It uses a GP41. A GP41 is the one that is responsible for fusion. It will get attached to the membrane of the host cell and take, the whole process of fusion. And then during that fusion, it opens up and then it releases the viral capsid. Viral capsid is the one that we'll be talking about right through, because lenacapavir is actually a capsid inhibitor. It inhibits that, what has been released into the cell, into the host cell. It is being released into the host cell because the host cell is the one that will help to make viral proteins. It will help to make the viral proteins. By itself, it's unable to make those viral proteins because it's an obligate parasite. It's an obligate, any virus is an obligate parasite. There's no virus that has got the machinery to make proteins. In other words, it doesn't have the protein synthesizing machinery like an ordinary cell. Like our cells, for instance. Our cells are capable of making their own proteins because they've got the protein manufacturing machinery. They've got ribosomes. Now, the virus doesn't have ribosomes, so it utilizes the ribosomes of the host cell. So when this is deposited, that is the viral capsid is deposited into the cytoplasm of the host cell. When it is deposited there, this is what kind of a virus is this? This is an HIV virus. It's a retrovirus. A retrovirus because it has in it reverse transcriptase. Reverse transcriptase is the one that has to reverse the RNA to DNA. Why do I say RNA? Because HIV is actually an RNA virus. So what actually went into the cell is an RNA. And according to the central dogma of molecular genes, there's nothing like that. Like we don't start at the RNA. We start at the DNA and then RNA protein. So that's the central dogma of molecular genetics. So it has to move like that. Now, so in other words, HIV, when it enters this cell, in the viral capsid. This HIV genome is actually contained. Is actually contained in the viral capsid. So the viral capsid is actually having enzymes to convert it. And which enzyme is this? The reverse transcriptase. That's the enzyme. The other enzyme that is there with it in the viral capsid is the integrase enzyme. But that will be used later in the nucleus. So it then reverses this RNA, and it reverses to DNA to form a proviral DNA or a viral DNA. A viral DNA which is now having all the information, the blueprint information for the synthesis of proteins, of viral proteins. So it has got the template, so to say, as to how to synthesize these proteins, right? So once it is in the cytoplasm of the cell, that is the CD4 T lymphocyte cell, that's what you have. That's important. That's the beginning of the story, because now you're going to have what is known as a reverse transcription complex. A reverse transcription complex says this viral capsid must now move to the nucleus because it has got a DNA that is ready to integrate with the cellular DNA, which is very good, right? Good for the virus, bad for us, right? But then for it to be able to move to the nuclear pore, to the nucleus, it needs some adapter proteins. That is, the adapter proteins are proteins of the cell. In other words, the host cell. So these adapter proteins are hijacked by the viral capsid. It hijacks it because it can, on its own it can't move. It can't move to those. It has got to be transported. It has got to be trafficked to the nuclear pore. And we know specific, adapter proteins. These adapter proteins, they are there to transport or traffic this. We know, for instance, that there's phase 1, there's BICD2 that will take it straight to the nuclear pore. Around the nuclear pore, you find some proteins which are docking there. You know, a dock. They are docking there. And these proteins are they are known as nucleoporins. The nucleoporins know they are very, very good in taking now this viral capsid. This viral capsid, you must remember, this viral capsid is having in it a reverse transcription complex. In other words, the proviral DNA with everything else inside is known as a reverse transcription complex. Now, a reverse transcription complex is saying, I am ready for integration because I have a DNA inside here, though it's a viral DNA. Remember, this viral DNA is to be integrated to the cellular DNA. Why is this happening? This is happening because it has got to form an mRNA, a messenger RNA, that will be sent to the nuclear, to the cytoplasm, into a specific location in the cytoplasm, and that is the ribosomes. The ribosomes, that's a place where proteins are made. But let's go back. We are right in front of the nuclear pore, which is going to take us into the nucleus. And what do we have in our viral capsid? We have in our viral capsid, we have a DNA that is ready. But now, the proteins, the adapter proteins, have helped to take this all the way from the periphery of the cytoplasm straight to the nucleus. They've done that. But around the nuclear pore, they need something. They need something to take it in. In other words, the viral capsid must go into the nucleus for integration to take place. What does it have inside? We said it has got a reverse transcriptase. It has a reverse transcriptase or a reverse transcription complex. Reverse transcription, which was made by the reverse transcriptase. Reverse transcription complex. But now, the most important thing, now, this one has to be remembered because this is where Lenacapavir is working. Lenacapavir was supposed to hijack proteins around the nuclear pore. And these proteins are known as nucleoporins, and hijack them to help transporting this viral capsid into the nucleus through the nuclear pore. But this needs to be done by the cellular or the host cell proteins. And those host cell proteins which are needed in this case, it's not the phase 1. Phase 1 has done its job. It's not the BICD2. That one has done its job. They were just for trafficking. They were hijacked for trafficking. But now it has got to hijack these which were docking here. They are around the nuclear pore, docking here. And the proteins that are supposed to be hijacked now to help the viral capsid to go into the nuclear pore, into the nucleus, straight through the nuclear pore. These are the proteins, the CPSF6 and the TAB, TUP 153. These two proteins, these two nucleoporins, they are nucleoporins because they are the ones which are supposed now to take it to the nucleus. They fail to do that because the viral capsid came, it utilized that interprotonoma pocket that it has, the newly discovered interprotonoma pocket, the one where lenacapavir binds. When it binds there, this viral capsid is unable to see the CPSF6, is unable to see the tag 153. These are the nucleoporins which are supposed to help it into the nucleus. That's what we need to remember. So it disturbs it disturbs the nucleocapsid, or it disturbs the viral capsid. It disturbs it from seeing and locating those nucleoporins. That's why it helps. So lenacapavir is wonderful. So it's not going to allow the viral capsid to get into the nucleus. In other words, integration is going to be a failure because of this. This is very good. This is something to be remembered, that the nucleoporins have been disturbed. It's difficult to locate them. It has arrived where they are docking. They're docking there. But the nucleocapsid can't make use of its ability to hijack because of the lenacapavir. The lenacapavir is stuck onto that pocket, the interprotonoma pocket. So now it makes sure that it is unable to locate, the CPSF6. It's unable to locate the TUP 153. It's unable to locate. And these would be very, very helpful in making sure that it enters the nuclear pore. And that's what needs to be remembered. That's where lenacapavir becomes an ace. It makes sure that there's no entry into the nucleus. If there's no entry into the nucleus, there's no way that the viral proteins are going to be made. This is good. But if there was an HIV or there was a viral capsid that went in, and in other words, now the viral capsid, let us suppose that it is inside the nucleus, right? If it is inside the nucleus, there's something else that needs to be done there. The viral capsid is made of capsid proteins. These capsid proteins, they're called the P24 proteins, and they are glued to each other. They are connected to each other, and they form a lattice. And this connection between them, they first of all have a monomer attached to another monomer, and monomers will grow, become pentamers, and the pentamers become hexamers, and the hexamer will bind to another hexamer. But now what happens? What happens? This is a viral capsid. A viral capsid. If the viral capsid interacts with the lenacapavir, the interface between these hexamers, it solidifies, it makes sure that there's no breaking or uncoating, because it overstabilizes it, so that there's no way in which there can be uncoating. Because when the viral capsid is inside the nucleus, there's only one process that will help the integration of the two nuclei, of the two DNAs. There's only one. It is the uncoating of the viral capsid. It has got to be uncoated. But now that uncoating has been made impossible by lenacapavir. Lenacapavir glues them together. Those hexamers, they're glued together. So there's no way that the uncoating can be possible. This is the second point. Remember, we said this is a game changer. This is a game changer. It started interfering with the nucleoporins, so that there's difficulty in the viral capsid getting into the nucleus. But now, if already the viral capsid is inside, but still it will be disturbed by lenacapavir, because lenacapavir is going to overstabilize the hexamers. The hexamers are going to be so glued together such that the uncoating becomes impossible. So when the uncoating becomes impossible, lenacapavir has worked. There's nothing that we need from lenacapavir. Lenacapavir has worked. This is what is known as disabling, the disassembly. The disassembly of the capsid. It's disabling it. The lenacapavir disables it. It's not going to happen. It's not going to happen. All right, you manage to get inside the nuclear pore, but you're not going to uncoat here. That's lenacapavir. It overstabilizes it. It overstabilizes. Multimodal. Game changer. Lenacapavir. Game changer. Overstabilizes the viral capsid. And then, let us suppose one mRNA was formed. You must remember what we need here. We want the integration of the proviral DNA to the cellular DNA or the host cell DNA. If they come together, they are going to be transcribed and form what is known as an mRNA, messenger RNA. This messenger RNA is going to be sent to the cytoplasm of the cell. Cytoplasm of the cell, what happens there? Cytoplasm, there are ribosomes, and ribosomes are the sites of protein synthesis. Now everything goes there. And the part of the mRNA that is coding for viral proteins, the mRNA, remember, mRNA has got to go to the ribosomes for interpretation, for translation into proteins. This is just information on a messenger RNA, but it has got to be translated to proteins. But the part that is to become viruses, in other words, the viral proteins, it is on a specific mRNA. And on a specific mRNA, and when it is converted, it becomes viral protein. And the viral proteins are coded for you always. They are always on a very large protein. They call it a gag polyprotein. Gag polyprotein, a very big And this will, in the ribosomes. So in the ribosomes are going to interpret that part of the mRNA, the part that carries viral proteins, the part that carries viral, but now they need to be translated to become proteins by the ribosomes. The ribosomes, they do the translation, and they translate it to become GAG polyprotein. So if you see a GAG polyprotein, you know that everything that is there is viral. Everything that's there is viral. The capsids are there. The RNA genome is there. The RNA genome is all of them. And they have to be packaged. They have to be packaged and assembled. Now, Lenacapavir comes in. Remember we said it's multimodal. It started with the nucleoporins, and it went inside. It refused. No, you're not going to uncoat here. So uncoating was made impossible by the lenacapavir. Now, we are there now. The proteins have already been formed. The proteins now are supposed to make an infectious virion. That infectious virion is not going to be a possibility because the assembly is going to be impossible in the presence of lenacapavir. So the maturation is not going to be possible because of lenacapavir. Lenacapavir, it disturbs the disassembly of the viral capsid. The disassembly. It disturbs it. It disturbs now the assembly of the viral proteins. Here is a GAG protein, which is carrying all the viral proteins, and they are chopped. And this GAG protein, this GAG, very big protein, is sent to the membrane of the cell. Is sent to the membrane of the cell where maturation takes place. Maturation, what's this maturation? Maturation is when the protease enzyme, which came in with HIV, protease enzyme. There are three enzymes there. Is the reverse transcriptase. It is the integrase, the one that was responsible for integration of the viral DNA and the cellular DNA, integrase enzyme. Number 3 is the protease enzyme. It works outside the nucleus, right in the ribosomes. In fact, even outside the ribosome, because it will be sent to the cell membrane, because the GAG polyprotein, which carries all the viral proteins, is sent to the membrane, where there's gonna be a budding. And budding, when a bud is formed, that will be, it's supposed to be your newly formed RNA. But now, this virion, or this viral particle, is very much immature. And it has been made immature. Okay, something that will mature, it will make it to be okay, is the protease enzyme. But the protease enzyme has been, the packaging and the assembly was not right. It was interfered with by lenacapavir. Lenacapavir disturbs the disassembly and the assembly. So the assembly into proteins now, into a viral or an infectious virion is disturbed because of lenacapavir. Lenacapavir, we said this is multimodal. Multimodal. It started early in the life cycle of HIV. Now, even late in the life cycle of HIV, it's interfering. Multimodal. This is the multimodal nature of this lenacapavir. This is what is important. To understand the multimodal nature or the multimodal mechanism of action of this lenacapavir, it does not allow the assembly. It does not allow the disassembly, first of all, because if it allowed the disassembly, it would be allowing it would be exposing the viral genome. It would be exposing the viral genome to the cellular genome so that they can integrate. So let that not happen. How am I going to do that? I'm going to disturb those those docking proteins, those proteins which are supposed to help it enter the nucleus. And those proteins, I'm going to make sure. How do I do that? Right in the pocket, the interproteinoma pocket, I'm going to attach lenacapavir. And lenacapavir is going to make sure that the viral capsid is unable now to see that this is CPSF6. This is CPSF6, which is supposed to help me. This is TAP 153, which is supposed to help me get into this nucleus. I won't be able to get into the nucleus because now the viral capsid is unable to hijack these two proteins to help it get into site. Number two, inside now the nucleus. Inside the nucleus, where integration is supposed to take place. This is not going to take place. I'm going to make sure that there's no uncoating. How do I do that? Put lenacapavir, between those hexamers of viral capsids, between the hexamers making the viral capsid, I'm going to put my lenacapavir because the pocket is in there. This interproteinoma pocket. I'm going to attach it there. I'm going to attach the lenacapavir there so that it solidifies. It makes sure that it glues these things together. In other words, the hexamers, they must be glued together so that there should be no uncoating. If for some reason the mRNA was formed and the mRNA goes now to the cytoplasm, that is to the ribosomes of the cytoplasm, I'm going to make sure that nothing like that happens. There's going to be no assembly. Even if the gag protein is there, gag polyprotein is there, with everything that is the viral proteins, everything that is viral, everything is there, but I'm going to make sure that there's no assembly. So it doesn't allow assembly and disassembly. This is very good. Thank you very much. Thank you very much.